Hi everyone, it's me, Dr. Steph Roche again, and today I'm going to be talking about menopausal hormone therapy, specifically looking at the benefits of hormone therapy. Future videos will discuss some of the risks, which is what most people actually know about, but today I want to explain why we give menopausal hormone therapy. So as we mentioned before, there are clear indications for hormone therapy. We have excellent research that shows that hot flushes, night sweats, so together known as vasomotor symptoms, and osteoporosis can be treated very effectively with menopausal hormone therapy. And internationally, guidelines from America, the UK, South Africa, all recommend menopausal hormone therapy as a first-line option for hot flushes and night sweats and osteoporosis. We know that in most women under the age of 60 and within 10 years of their menopause, the benefits of hormone therapy outweigh the risks, and it's a relatively safe choice, often safer than some of the alternatives. So chat to your doctor if you're struggling with this. So that's why hormone therapy came about and what we use it for now. But there are other benefits. So these benefits are not indications alone to start hormone therapy, but they're definitely something to bring up with your doctor. And for example, if you're suffering with hot flushes and you're not sure about hormone therapy, but you have one of these other symptoms, that might convince you that hormone therapy is a good choice for you. So we have a lot of research emerging that shows that menopausal hormone therapy, beyond those clear indications that I've discussed, also helps with mood symptoms. So a lot of women struggle with depression, low mood, anxiety during menopause. And we know that when women have mood changes, not necessarily meeting criteria for a diagnosis of depression, but they do have low mood or other symptoms of depression, typical or the classic antidepressants that we use often don't work, whereas menopausal hormone therapy has been shown to improve mood in menopause. We also know that menopausal hormone therapy can help with low libido. It can also help with vaginal dryness and sexual pain, which are all a result of low estrogen. Interestingly, if you take menopausal hormone therapy, so the tablets or patches or any of the combinations, and your symptoms of sexual pain or vaginal dryness or irritation don't improve, you can also add on the topical estrogen, which Dr. Rebecca Cooper mentioned before. So even if you're on menopausal hormone therapy, if you're still struggling with vaginal symptoms, we can definitely add vaginal estrogen on top of that. And then finally, we know that menopausal hormone therapy often helps with sleep. So especially the progesterone tablet that you take at night, that can really make you feel drowsy and help with your sleep quality. And by improving hot flushes and night sweats, your sleep quality will most likely improve as well. Then in terms of overall risk reduction, women who start menopausal hormone therapy within 10 years of their final period, so within 10 years of menopause, and below the age of 60, they have an overall lower mortality than other women. They also have a lower risk of cardiovascular disease and a lower risk of diabetes and metabolic syndrome. This is because estrogen is protective of your arteries. So it protects your heart and your brain and your other blood vessels. So by replacing some of this estrogen, we get some of that protective effect. This is especially important in someone who previously had gestational diabetes. So if you had diabetes when you were pregnant, or if you have polycystic ovaries, we know that you're at increased risk of diabetes, and menopausal hormone therapy can then reduce this risk. Finally, we know that menopausal hormone therapy reduces your risk of colorectal cancer. Overall, we know that menopausal hormone therapy has lots of benefits, and if used in women to treat hot flushes, night sweats, and osteoporosis, generally the benefits outweigh the risks. But you always have to discuss this with your care provider, because we all have different family histories, we have different risk factors such as smoking, etc. So we need this to be a personalized decision. Very importantly, this golden window when menopausal hormone therapy shows all these benefits is within those 10 years. So in the majority of women, we don't recommend starting menopausal hormone therapy after the age of 60 or after 10 years since your last period. So there is a window when we've seen the benefit. starting hormone therapy later means that you're putting estrogen hormone on top of already damaged blood vessels, and that's when you have higher risks of, for example, stroke and heart attack, etc. So these benefits that I've mentioned are for women within that golden window. So if you are within that time period, or even afterwards, we still have other options, and menopausal hormone therapy might just be the right option for you. Go and chat to your doctor, and we can help you get through menopause.